Thank you all very much. I'm Brad Ott. I'm actually a current outpatient of the LSU system. So I'm seeing some of what Dr. Thomas had mentioned. First off, there were some questions that were submitted by Louisiana Healthcare Matters, and I endorsed those questions, and I would hope you all, as senators, would investigate those further. I know you mentioned, Senator Shepard, that you were going to have, time to ask the particular questions with Dr. Cerise and stuff, and those are important, and I've heard some of those questions today asked and some answered. Senator Quinn, that was here earlier, I wanted to appreciate for her playing the elephant in the room. It's a role I know well, but it's better that a senator asks the questions rather than a lowly patient like myself. As Senator Gray has suggested, a new hospital which has been authorized should not be confused with the need for a hospital now, facilities now. And I'm not arguing against the new one. I actually, as a member of the Region 1 Healthcare Consortium, I was part of a committee that endorsed the new hospital. So I'm not arguing on that. Although I might add that the Adams report that was set up to analyze that and also to analyze the damages afterwards, one has to question the wisdom of the independence thereof. There has not really been an independent evaluation of that facility, of Big Charity. And even if you go by that, as I think they can honestly respond to, Charity was less damaged than University Hospital by several percentage points. And yet they chose to open up the smallest facility despite the need being the biggest. There was a process that was implemented to get that kind of study going and independent evaluation done. It was done by this legislature. Several of you, either in the House or in the Senate, had voted for this. It was HCR 89. It was passed without opposition. Why it hasn't been done, I don't know. But just a few moments ago, I did serve Dr. Cerise with a public records request about that, and I'll be serving Jerry Jones with that, because those are the two players, the Office of Facility and Planning and Control, which supposedly runs the hospital, and they have the LSU system now, and curiously was also the DHH secretary before. I've asked this time and again, and it's endless, and I'm sick of asking, and yet that's an HCR. It passed. It's a law. You might say it's an HCR. Well, an SCR authorized the new hospital, and a legislative instrument of the same weight. And I wonder about that, and I'm just kind of outraged. So I have copies for you. And by the way, I've also made additional public records requests of Dr. Orleanian, Dr. Thomas, Dr. Butler. And this is regarding another issue which has arisen, and I don't know what to make of it. We talk about facility crunch, and there was all this talk about Charity Hospital being unworthy of accreditation. Well, it's been brought to my attention that the very accreditation of University Hospital is in question, and that these mental health ER extensions in trailers, by the way, don't meet up to JCO standards. But rather than act on rumor or try to figure out on rumor, I decided to file as a public records request myself to get to the bottom of it. It's outrageous that we're left with makeshift care. And I think you all have heard from your constituents previously of the tents that we've had to go through and all the steps in the experiences that we've had to do when there was a hospital that its workers and the military cleaned out and had ready to reopen 3 weeks after Katrina. Yes, the electrical switches were damaged in the basement, but there were third floor switches that were hooked up by Entity, and there's lights in that building. And they succeeded in getting that building ready to reopen. I mean, we had the military do it, along with the medical staff. And the public health service and everything has determined that it was something that it could be done. And under the surge capacity issues of use of hospitals, you could get over those accreditation questions if you really desired to provide the care. You know, I think we need to honor that effort. And, you know, I don't know, I feel very conflicted about this. As a patient in the LSU system, as one whose life was saved when I had a stroke 4 years ago, and would, quite frankly, to the private providers and other providers, none of you are really affording care to the uninsured. Only the LSU system is doing it. I'm encouraged by the medical homes, and some of them then are really truly free, but the methodology of qualification for them, frankly, it's only laid out by LSU. So my comments are really posed on the fact that we have a health facility that could be reopened, and we need a reinvestigation in this. You know, we don't really know what happened. There's never really been an investigation. And it's funny, Dr. Thomas said, stem to stern, what the renovation costs. Well, State Treasurer John Kennedy said that same statement. Stem to stern, charity could be brought up to code for $250 to $300 million. Now, obviously, there's a gap. So let's have an independent evaluation of this. And we, the residents of Louisiana, are really entrusting the legislature to do this. I want to also raise the issue, and I guess also, and I will wrap up. There was the issue that's been raised that the lack of money. If we went into, Jerry Jones has said this, if we build on the old, FEMA won't pay out the right amounts to us. And those of us who are students at the University of New Orleans and SUNO also know that. We've got buildings that are still shuttered. SUNO is far worse off because of that mantra. I know the DHH secretary has left, but I'm going to put it to his attention if he's going to reconsider things. There was a grant of $352 million that was given to DHH, and much of it was returned because they said that they couldn't use it and they didn't request it. We need to do further investigation into why that is when we actually had money. And in my very limited investigation through public records requests, I found that, according to the Military Department Office of Emergency Planning, that $350 million might have been for charity right at the time of the storm. And I give this to the chair.
Thank you.
And, you know, what I'm really concerned about is that we're going to be going 3 years and 4 years. And we're going to be strangled. And there are proposals in the legislature that you all know that are about breaking up the healthcare system. And I'm opposed to them, by the way. I'll stand with LSU and fight those. But we need immediate assistance now. And you guys have the power to enforce the law in order to get them in and have a bona fide inspection. The Foundation for Historical Louisiana has money in the bank to do an independent engineering evaluation. And it needs to be done now. And I'm going to continue to be an LSU patient as long as I'm in my considered condition. But knowing what everybody's going through, it's really compromised. You know, there were more than 150 clinics before the storm that were operating 6 days a week. To have half-day clinics at places where the ceiling doesn't go all the way up to match the walls and you can hear the conversations. And that's what they complained about Charity Hospital. Well, that's what's being paraded as advanced care now. And we really need intervention here. Thank you.
Thank you, sir. Mr. Andrews?